Nothing can ruin your day more than a lot of bleeding. All you need is a little blood spraying everywhere that kind of ruins your schedule. So part of planning for surgery is to prevent that sort of problem, and if it still occurs, figure out the best way to handle it. One of the things that I have found very useful, if you've got bleeding that you want to stop, and that bleeding is the primary problem you're having, and you can't stop it by suturing over the site, you can't stop it with a pressure dressing, there are a couple of good products on the market. And one of my favorite one is Wound Seal powder. Wound Seal is a very interesting mix of a Moncell's type solution on top of little tiny microscopic plastic beads. And you just slap this into a wound, put pressure on it. It has an exothermic reaction, and when the heat goes away, you take the pressure off, and the bleeding stopped. You can't close over this, you have to leave it open to the world. It has to heal by second intention from that point forward. But the cosmetic results are excellent, infection rates are low, and it's a wonderful product, and it's dirt cheap. It costs about $1 per wound, which is marvelously inexpensive. And when nothing else will work, it's great. After applying the Wound Seal, I will typically, in a small wound such as a punch biopsy, maybe just put a Band-Aid over it. On a larger wound, I might protect it with a piece of Opsite or Tegaderm and let the patient leave it there for 7 to 10 days. If they can come back, I'll take a look, or if they can't, I'll peel the Opsite off and then start putting Vaseline in a Band-Aid. That will soften up the product. The product is shed from the wound, there's healthy granulation tissue, and it generally reepithelializes over quite rapidly. So it's very easy to work with. Now, there are more expensive things you can use. You can mix up products that have thrombin and fibrin in them, but you're looking at hundreds of dollars per use, probably more than you're getting paid for the procedure. So something like this that's $1 a shot, it's wonderful. And if you want other options, there's a product called Quick Clot, which is a kaolin impregnated gauze. And the Quick Clot, you simply slap it on the wound, it activates the clotting cascade, whether or not the patient is on anticoagulants, whether or not they have factor deficiencies, and the bleeding stops. And you can leave this stuff on for 24 hours. It peels off very quickly. It's basically a clay in gauze, and the clay sort of separates atraumatically. And you can always deal with the wound the next day. But again, an inexpensive approach as opposed to the $1 per use. This is more in the $6 to $7 range per use. But if it's a choice of something like this that keeps your day on schedule, or having your day delayed by a half hour or 40 minutes, even $6, $10, $15, that's cheap. That's less than you'll be losing by having angry patients walking out of the office. Wound Seal is meant for a wound you're going to not suture over. So if you're taking a small punch biopsy that you might otherwise let heal, Wound Seal can take the place of a suture. It's a lot cheaper. You don't want to suture over it because it doesn't dissolve away. It's not meant to be buried and would likely cause a foreign body granuloma. The same problem with products like Quick Clot or Chitosan, which are, the Quick Clot is the kaolin derivative, and the Chitosan is, with Celox, I believe is the brand name, it's basically insect or shrimp chitin. And again, you can't bury those. If you want something you can bury, then you can go ahead and you can get Arista AH, which is a microporous polysaccharide microsphere from potatoes, essentially a fancy form of potato starch. This stuff used to be dirt cheap, and every high school coach, every college coach, they'd have this stuff, and if somebody had an accident on the field, they would just slap it into a wound. But then when the government got involved in incursions into South Asia, we started running into problems with shortages of this, so the prices went sky high, and the prices have stayed there since then. I think the government still buys most of their inventory out. So you generally don't see this in the office. It's more the sort of thing you'll see in an operating room. In fact, the website has a lovely video where they show some cardiac procedure where somebody is dumping a cup of this stuff in and just putting pressure and the bleeding all stops. That will be reabsorbed by the body. So it does work well, it's very pricey for office use. The other products we discuss will persist and create a reaction such as a granuloma that you don't want.